Hi, it's Dr. Elisha Van Duzen at New Hope Chiropractic, and today we're going to talk a little bit about the knee joint. The knee is a complex joint that relies heavily on ligaments and also muscles around it for stability, and it's a major weight-bearing joint of the body, which is actually composed of several different joints. The tibiofemoral joint, for example, it's between the thigh and the lower leg. The patellofemoral joint, which is between the kneecap and the thigh. It's got muscles and ligaments, which give it active and passive stability to the knee. It has two ring-shaped cartilage discs in the knee. These are called menisci, or one is singular as meniscus. So you have one on each side. And when pain is perceived as coming from the knee, all the anatomical components have to be looked at and checked out in addition to the knee joint. The low back, the pelvis, the hip, ankle, and the foot, they all need to be examined and carefully looked at as to the direct influence they have on the knee and vice versa. The interplay between all those needs to be looked at. So as a chiropractor, I take a comprehensive medical history and I perform a thorough physical and biomechanical exam, and with that I can make an accurate diagnosis, and without an accurate diagnosis, treatment won't be very successful. And our approach of assessing and treating the knee includes the evaluation of the other joints and muscles relating to the knee. And this is for several reasons. Firstly, pain can be referred from other areas, and in the low back, for example, the pelvis and the hip to the knee in a variety of conditions. Also, if other joints in the lower limb are not working correctly, they can put increased stress on the knee joint, resulting in degeneration and injury over time. And by that I mean problems with the foot and the ankle, for example. So therefore, in order to get rid of the knee pain, as a chiropractor, I also have to treat other areas oftentimes to maximize the long-term improvement, like the ankle and knee joints, foot joints and bones in the foot, and things like that. So I've outlined basically the process of the treatment. Now in the next part here, I'm going to outline the process of the treatment. And stage one typically includes reducing joint inflammation and reducing the pain. And we do this with avoidance of aggravating factors. We may supply a support for you, some sports tape, ice it down to reduce inflammation, decrease muscle spasms, decrease pain. Also help the soft tissue to heal with ultrasound and also some interferential therapy. And then secondly, we want to normalize joint function. So that's where the chiropractic adjustments comes in. Chiropractic adjustment comes in. Also mobilization techniques, passive movement, for example, that breaks up the restricted movement, helps everything to move properly again, and then the function will improve as well. And sometimes you may also need, someone with knee pain might need deep soft tissue massage or trigger point therapy, cross friction as well. And then step three is a rehabilitative exercise program. So the exercises then will improve strength, endurance, and stability, basically supporting the whole knee joint so it's not injured again as readily. And we'll also work on improving your balance and your sense of joint position. That's called proprioception, by the way. This will help you to return to normal and also prevent new injuries. So if you have knee pain or you know somebody who has knee pain, have them check us out at newhopechiropractic.com, and they can, you or they can make an appointment there as well to get checked out and get the knee pain taken care of. So hope this helps, and have a very healthy day.